And Bodil, can you hear me? This is a test, Bodil. You get to say yes or no.
Yes, I can hear you.
Zoom is working, which is always handy.
Yeah.
Excellent. Kathy Somerville can hear me as well, which is always handy to know. There you go. Bodil, you've got about 4 different presences on the Zoom today, so you must be very popular or logged in many times.
No, that's weird. How could that happen? That's probably coming in from Deaton, but 4?
All good. Anyway, let's not answer that question now in case it incriminates us later on. Okay, it's after 2, so it's probably worth making a start. So hello everyone, welcome. Another catch-up. I'd like to start by paying my respects to the custodians of the land on which we're meeting. For me, it's the Wurundjeri and the Boonwurrung people of the Greater Kulin Nation, but you may be on other Aboriginal sites. And I want to pay respects to elders past, present, and importantly, emerging. So thank you for joining me today. I apologise that it's going to be a little bit of a repeat of last week's because I stupidly failed to put the recording onto a stick before my computer got nuked. So it didn't exist. So we'll cover up a bit of ground from that, but hopefully only very briefly, and then we'll get into the questions. So if you can use the question and answer tab to raise your questions, it's pretty handy for me then to be able to answer them. I thought I'd start with sort of COVID stuff first and then flip it to non-COVID stuff at the end. So in terms of COVID stuff, I suppose it's exciting news that things are changing and we're getting better case numbers. Obviously the restrictions are starting to ease a little bit and you're all, I'm sure, following that on the press and on the news. And it's a pretty fast moving space. But good news is that the numbers are coming down. But I just want to sort of put it out there that Western is still at the epicenter of a fair bit of activity. I'm just going to check. We got 6 positive COVIDs in our care at the moment with still 1 patient in ICU and a staggering 54 still suspected of COVID. So it's really important that we don't let our guard down. We're still getting staph infections, sadly. I've had another infection over the weekend come back as positive. So it's still a really nasty virus that will infect people if we're not careful. So please continue to be really hyper vigilant. We're still having some patients that are asymptomatic and folk are catching it that way, and particularly with donning and doffing. So, you know, use the spotters, use the buddy systems, do your best to continue to stay on the right side of all of the guidance that we've put out. Some other things to flag about COVID. One is the fact that I spoke last week about the fact that WorkSafe had been to ED at Sunshine after a sort of, I'm going to say, vexatious complaint that someone had shot a video back in March and then dubbed it as though it was kind of the day before it was posted on social media, which was kind of a couple of weeks ago. That led to a complaint that WorkSafe had to come and investigate, but they actually had a comment that it was exemplary PPE practice at the Sunshine ED and didn't find anything to substantiate the complaint. So thanks to the ED team at Sunshine for doing a great job all of the time, as many staff have done in those high-risk areas with PPE. I know it's damned uncomfortable, but great that WorkSafe could kind of say it was a scurrilous complaint with no evidence to support it. The other thing is we've had a Safer Care Victoria visit and also an outbreak team visit to 3B and Safer Care across both Sunshine and Footscray. Both were pretty handy at looking at some lessons learned, and they were pretty low on. The key bit was around usage of WOWs and high-touch shared spaces. There was observed practice of staff coming in out of patient rooms wearing gloves, touching the WOWs or high-touch surfaces, and then going back into the rooms or, in worse still, into other patients' rooms without changing gloves. So there is a high risk of contamination from that purpose. So again, take 30 seconds to just use a Clinell wipe. I'm sure other wipes are available, but Clinell seems to be the brand of choice, and wipe down the computers or the high-touch surfaces just to protect you or your colleagues. And that's the same in terms of you know, meal break areas, etc. So take 30 seconds just to give it a wipe down with the stuff that's provided to protect both yourself and your colleagues. That'd be really appreciated, so thank you. We are still supporting 2 nursing homes, although I think we're coming out of Wyndham Lodge tomorrow. So the team on the ground there have done a fabulous job. That home has had an outbreak running for about nearly 60 days, so I think 3 months before we got there. We've now pretty much eradicated the outbreak, sorted out all of the positive patients that are now negative and clear. So I think a fantastic effort by the team that's gone in there. And that's been really positive because it seemed to be the issue that no one else could fix. So they called in Western Health and we kind of did it. So well done to the guys on the ground and all the support teams that have been on there helping turn that around. It was a particularly big home with 150 residents in it. So it's really important that we got that back under control and also helped educate the staff under what PPE guidance they need to wear, etc. The other home that we're supporting again is Florence. So we did a great job bringing the COVID outbreak under control previously. We left it and now we've been asked to go back in. So again, we've got a team on the ground in Florence doing some great work in the pretty challenging circumstances. And we'll continue to watch how that progresses so that hopefully we can do our work there again and get back to normal business. It's a pretty unusual setup for us around taking on aged care facilities, particularly private ones. But again, the teams have been doing a great job in doing that across the board, and our residential inreach team have still been doing the hard yards across the community, supporting a whole range of other homes. And that's been invaluable in terms of controlling the spread of outbreaks, helping educate, but also importantly for us to bear in mind, supporting the residents whose home it is and meeting their wishes. So yeah, that's been hugely important. In terms of visitors, I just want to make a bit of a plea to remind staff that we still and have had for a number of months now visitors allowed in our sites. It is significantly curtailed and it's only one visitor for a maximum of 2 hours now, but they can come in and see loved ones. There's still a lot of confusion, I know, because some of our near neighbouring hospitals are refusing visitors. Some are doing things slightly differently, but at Western Health, we can allow and do allow visitors to see their loved ones. And we're still getting a number of patient complaints that they're not able to have a visitor. And that's important in terms of caring, mental health and emotional support. That's not 10 people at the bottom of the bed having a bit of a chat and a social interaction, but it is important in terms of social interaction with that one visitor and some contact. So I know there's been some changes on the weekend around paediatrics and parents and other things. So I'm sure that there'll be some more quick reference guides coming out in the next little while, just to update on what the visiting thing is. But generally, unless it's in a high risk area, we can visit. If it's in a high risk area, then we do need to take different precautions, but we can also facilitate that too. So watch this space for the QRG for the detail, but my aim was really just to say visitors in wards that are not sort of high risk. So not in COVID, not in SCOVID, not in ICU, but they can go in to the chemotherapy, cancer oncology wards. They can go into aged care wards. They can go into rehabbers, etc. So, just please sort of help folk get some social contact. In terms of non-COVID work, clearly the health system is changing. We saw at the weekend there is a new health minister now after the departure of Jenny Mikakos. So Martin Foley is our new health minister. I'm not sure what that's going to be in terms of his directions, but I'm sure we'll find out soon enough. But as far as we're concerned, all that we're doing will continue, and Western Health is pretty hectic in terms of that sort of building program and change program we're going through. So again, watch this space for more updates, but I'm assuming that won't change. We are missing our volunteers. I know a lot of people have raised that with me in previous chats, and we had hoped to get them back. That's not on the cards yet. But I know the volunteer team are looking at virtual volunteering, and many of you will know Joseph, who's the violinist that plays in many of our lobbies and areas. So he started to do some virtual concerts across lunchtimes for ward patients to listen to. So we'll continue to roll that out as we've trialled it now twice, and that's gone down particularly well with those trial areas. I also want to say a huge thank you to our staggering support we've had from our community. We've had over 40,000 separate items of things donated to us, and the number of donations from supporters continues. To that end, I've got some props today to hold up. So we are issuing shortly, and you'll get looks like that. It's a canvas bag, and it's got on there, if you can see that, the handle's in the way, so you never go on TV. Not just essential, but exceptional. And in that bag is a whole range of products that our kind donors have given us. There's things like hydrating masks. I'm sure I'll get some good use out of that. And plenty of hand creams, facial moisturizers, water, there's chocolate bars, and there's also a kind of thank you note from the exec. This is a prototype, hence the clips on it, but really just to say a huge thank you from the executive team and the organization in terms of the work that everyone at Western Health has done. We are going to need your help distributing them. It's a bit different than normal. We can't just kind of run around and give them. So we will be focusing on clinical and non-clinical frontline staff to start with and distributing those out through managers. So we've got 6,000 care packs to give out. So we'll look to managers and shift leads for support to make sure that people get the care packs. And hopefully you'll enjoy a little treat and some pampering at the end of a long shift with some face masks and other products. But it's been a great benefit for us, for our community to give so generously, and some of our big industry partners around here have been donating things in significant numbers. So watch out for care packs, and hopefully you enjoy those. One thing that I know is always the case at Western Health and has been further sort of identified through the pandemic is our ability to think outside the box and come up with novel ideas. We've had loads of those, like the Cold app, we've had the isolation hood, and many, many more clever inventions, face shields, etc. So we've been working with the University of Melbourne, who've helped us with some of those commercialization bits and development of some of our ideas into actual concepts. And we've collectively come up with a innovation accelerator program that Paul is going to launch on the 1st of October. I know there's been some Zoom links gone out there, but it's basically a program whereby which folk with ideas can pitch them to the Melbourne staff, and the university will put some resources behind trying to take them forward, and there's some real cash involved in supporting that. So it should be some good fun, but importantly, it's a great way of people to get innovations off the ground and supported. And our biggest win to date has been Craig Nelson and the Future Health Today program. So Craig took his innovation through all sorts of development to end up in a multi-million-dollar grant to take it on even further. So we have a great track record and tons of bright ideas. So please feel free to watch that Zoom launch. It's all virtual, but any great ideas, start to think them through, and you can pitch them to the engineering teams or university staff to try and get them off the ground. So as I say, emails have gone out, Zoom dates are there, but I'm sure Paul will be refreshing that. Digital CTG has gone live today, so a huge thanks to all those in the maternity space. It's been frenetic, I'm sure, to get to this point, but a very smooth and safe go live. And it's great to see the fact that we've now got CTG monitoring across the organisation or across all the birth rooms. So that's been a huge benefit for us, and I know it's something the team have been driving at for about 2 years or more now. So it's great to finally see that come through. Or staying on an EMR face, I mentioned a while ago about the infusions program. I'm pleased to say that 93 of our colleagues have been heavily involved in user acceptance testing, and the workflows have all been exhaustively tested by those staff that gave their time so freely, which is great, so thank you. And I'm pleased to say that we came out of that process with a tick of approval to proceed. So there were no significant risks to stop the infusions program going forward. All the workflows work. So we will continue to move on now to training with an aim to go live towards the end of November. So again, watch this space for further info, but good news that we're through the sort of technical challenging bit. And now we're doing the training, getting ready for go live, which will be another development of the EMR, making that slightly better for our staff and our patients. I had hoped to give you a bit of an update on the Footscray Hospital, but that still hasn't sort of come out with an answer as yet. We're still in the evaluation phase. But again, that may be announcing relatively soon about a movement on that front. I can't say anything more at this stage, but I'm hopeful that we'll be able to make an announcement to the organisation in the next sort of week to 10 days. So watch out for that, and that should be really exciting as we get to find out who the preferred bidder is. So as I say, watch this space. I think that's probably all I was going to say in terms of a general update. Thank you for listening. I'll go to the questions as we've had a few come in. On the chat, do the WorkSafe findings get communicated externally to mitigate the negative press for Western Health? I hope so, is the honest answer, but I'm not quite sure we'll see that. It's generally a WorkSafe issue. The good news for us is we've got an email trail now from WorkSafe closing that down. For us, for all intensive purposes, we showed that we're doing great work and following the rules and the guidelines, and WorkSafe put us to the test and found that to be the case. So they may put it on their website, but they'll certainly go back to the complainant and tell them. They may put it on the website, we'll see, but we'll certainly herald it that there's no case to answer as far as we're concerned, which is always helpful. The news advising that a visitor can visit a patient for 2 hours, have the hospital rules changed, as previously there were no visitors except exemptions. So the rules for visitors have been a bit of a mixed bag. They've been allowed probably for about 4 to 5 weeks now, if not probably slightly longer, when the health minister changed the directions previously. As I say, different hospitals have had different interpretations, which hasn't helped understanding. And we certainly had a policy of no visitors to ICU unless exemptions were sought and in effect authorised and the right steps were taken. But we've even had visitors in that period to ICU that have been very carefully managed to support the wishes of families at the last rites or the last minute as patients were dying. So we have allowed visiting. I know we've had a number of complaints, and I've had a number of emails that people couldn't get in. And we've sorted that out with them. So as I say, watch this space and check the visitor guidelines, but we have allowed visitors, and the minister actually changed those a little while back because there was a period of no visitors, and that then started to move largely because of the outcry from patients and families about a lack of contact. So hopefully that answers that one. At which point will our annual leave and long service leave stop being cancelled or reduced to 1 week? So hopefully that will start to move forward. I'm sure later today, the governance group around COVID will start to discuss those things. As restrictions ease, then there's more options for leave. Obviously, when we put that rule in, or when I made that decision, it was around the fact that we were looking after about 300 plus COVID and suspected COVID patients a day, and our service was pretty stretched. For those of you that didn't know, we've probably put on an extra 7 wards of 32 bedded equivalent staff to support all the initiatives we've been doing to work with our community and for government to look after COVID. And we've been probably the busiest, if not the second busiest health service in the state, probably in the country as a result of that. So we did need a lot of hands on deck. We will have a look at annual leave, and we've always had the opportunity, if people had leave that they really wanted to take, they would and could, but that easing of restrictions will probably start in the next little while, so that folk can start to get a break. And some of the other stuff is around people going back to school. It might be good to take a break rather than take a break to go into homeschool. So again, watch this space on leave. The stairwells in the multi-storey car park at Sunshine are very dirty. There are old masks and coffee cups. So thanks for raising that. Through this, I'm sure Chris Newman and her team will pick up on that and go and sort that out. But it's a Western Health facility and we have to look after it. So Chris and the team, I'm sure, will be onto that. But if not, I'll follow it up outside the meeting and make sure that they get looked at and cleaned up. So thanks for raising that. It's a spot that I haven't seen because I'm not traveling to Sunshine, but important that we keep everywhere as clean as we can. When will managers receive a directive regarding longer leave periods over the Christmas period, being that rosters are prepared for the middle of January? It'd be great to know if we can take a good amount of leave. All leave will have to be discussed with your managers. I'm sure lots of people want leave, but we can't have the whole health service on at the same time, I'm afraid. We will look at how we do that and how we roster it. So once we can release some updated guidance about leave, I'm sure those conversations will happen with your managers. And rosters, etc., and planning can happen. But as I say, we can't have everybody off at the same time for obvious reasons. So bear with us, I think, is the only thing I can say on that one at this point. A couple of weeks ago, I asked why ED medical staff had to complete a paper form listing who was at work for their shift. I said the app was all that was needed, that we now need to complete the paper. So yeah, so last week I said that I'd got that wrong. I thought the app was good enough, but apparently it's not. So for contact tracing purposes, we have to know what department you've been in, because you may have been elsewhere. So the app tells us that you are symptom-free and are at work. It doesn't tell us where you are at work. So everyone has to fill in the paper form, me included, and it tells you where you've been and where you haven't been. So if there's an outbreak, we can contact trace you very quickly and either put you into quarantine or release you and sort of say you're okay and not a close contact. So we had hoped that the app would do both, and I sort of jumped the gun on that and thought we'd got there. We hadn't. So the paper form does exist, and we have to fill it in. So even if you fill in the app, please also fill in the paper form to say that you're on that particular department, because it may be an ED that you're working in there. You might go to the EOU, you might go into radiology. You have to fill in the bit of paper in all of those areas. That's part of our COVID safe plan and part of the requirements. So my apologies for that one. I was jumping the gun, but at the moment we can't alter the app to do all the things that we want. I know the guys are trying, but at the moment it's just filling in the bit of paper and doing the app as the attestation. When can we work across campus? That's a good question. At this point, we honestly don't know. The work directions are still in force. So whilst the Premier announced that a whole range more people are coming back to work, it's probably still a very small number that are being allowed back out of the total workforce. So we've still got a number of people working from home. We still have to work out about physical distancing in offices. I know we haven't really got that, but the rules around multi-site travel, cross-campus working haven't relaxed. The directions are still in force. So until those get relaxed, we're still pretty much stuck as we are. And part of the challenge ongoing will be around not taking COVID across campus if we can help it and knocking out multiple teams. Some of our sister health services have seen that happen where they've lost whole departments very quickly, either because someone's furloughed or someone is positive and therefore has to go off and knocks out the rest of the team. We saw that happen at Werribee very quickly and very alarmingly for the ED staff. They lost a lot of their clinicians very quickly and had to almost close the department. So we'll continue to keep that under review, but at the moment the workforce directions don't allow, I'm not going to say freedom of movement, but cross-campus working. For special exemptions where there's an essential need, we can do that, but as a general rule of thumb, we're not doing that and we can't do that just yet. And I know from various conversations with DH, there is an ongoing discussion about workforce mobility and the fact that they don't want mobility in the workforce just yet because it is a way of spreading the disease. And that's a really tricky way of trying to control it. So as I say, we'll get back to you when we can with any changes, but at the moment we're still on single campus, which I'm sure is incredibly frustrating. I can't go across site as I used to, which it gets a bit a shame you can't see what's going on the other campuses or see staff and say thank you, but we're in the virtual environment for a while longer. Is there a plan for staff who have been redeployed into other positions to return to their original positions? So ultimately, yes. When that happens, I don't know as of today, because some of those staff are still doing invaluable roles in those other bits and their service hasn't returned back to normal. So as we start to see restrictions lifting and services coming back to normal, we'll have to continue to relook at who's where and who's been redeployed and how we then get them back to that service to start it up safely and appropriately. So that is always on the agenda. We've got a list of everyone that's been redeployed and what they're doing. And part of the work we've got to do now with government and the Department of Health is work out how do we function in whatever the new COVID normal happens to be. And that will be around how do we physically distance in the workplace? How do we get patients and outpatients back in? And what does that look like? Does it happen more virtually? Do we have different numbers? Do we change the templates? How does elective surgery work and all those kind of things? So there's still a fair bit of work happening. Community services, outpatient rehab, all those things are up for grabs as to how we do them. But at the moment, it will look very different in a sort of post-COVID world to a pre-COVID world. So it is on the radar. It's still part of our thought process. But as I say, we haven't yet got any answers to that, I'm afraid. What are the plans for Hazeldene? At this point, Hazeldene remains closed. We are talking to staff about that, and we're also talking to government. As a result of that, we're seeking some funds to improve the airflow in Hazeldene, which is sizable. And also it's very clear that the shared bathrooms and shared rooms are on the small side for the numbers of patients that we've been supporting in there. So we are working with government to put in place the learnings from the COVID outbreak and make some changes. So we're waiting on confirmation of funding to start that work. We'll continue to work with staff to keep them appraised of that, but at the moment, Hazeldene remains closed to patients and staff, and we'll continue to see what we can do and how we can do that with government going forward. There's certainly no plans in the long term to close Hazeldene, and government have supported that conversation. So we're just working with them as to about how and when we can start some remedial works to improve all of the airflow and HVAC systems in there. So watch this space on that. But as I say, we're redeploying staff at the moment, and we'll have ongoing conversations through the line management piece. Can we add the location of staff to the app? I'm told at this point, no, we can't. I don't know the technical detail as to why. Others may have that. But we'll continue to follow up and keep folk appraised if that changes. But at the moment, we can't do that. I don't know the reason why, but that's the answer of that. What's Western Health's position on managing social distancing in the frame of staff returning to face-to-face work? How are we planning on managing this from a space perspective? I guess the answer is in a challenging way. We don't really have tons of space. In the summer, it might be slightly easier, and some of our sister health services, I don't say near neighbours, but it's not quite near neighbours, are planning on doing a lot of staff areas outside and waiting rooms in marquees on lawns and things. So we'll probably get some more guidance on that. But certainly at the moment, all of the physical distancing rules still apply. So that applies to waiting rooms, tea rooms, offices, etc. So it may be that we have to revert back to how we did in wave one, with kind of rosters of A and B teams to ensure that we've got the physical distance on site. And we obviously have to wait for some of those workplace directions to change to get more staff back rather than have everybody away that can be away. So again, it's kind of watch this space. We're working through all of those sort of space areas, and as you'll have seen, there are stickers on multiple chairs saying please don't sit here and don't sit there. The key is not to then move the chairs or tables, which I know on occasion I've seen folk doing. They're there for a reason, and we keep getting audited on that. You may not see the auditors, but there is an audit process underway that we have to then prove as part of our COVID safe plan that we are complying. It is going to be tricky in the new COVID normal. And as I say, visiting won't be back to as it was with lots of visitors around a bed space. They'll probably limit it to one going forward. Outpatients will be a different space. Offices will be the same. We don't have the luxury of modern offices. We're in relatively old buildings at the moment, but we're applying that learning and looking at how we get folk back in a structured way. I've missed one. So our EMR team are saying that we've now got a new branding and name coming out. So it's going to launch later today. So it's Digital Health Connecting Best Care. So what was the EMR Phase 1 Go Live program and other bits of work that we were doing around that will all now come under a Digital Health Connecting Best Care banner, and all the projects will be around doing that. So exciting times in terms of the digital health strategy and how we're taking that forward. So watch out for some good comms around that and some launches later today. So thanks to the guys on doing that. And I know Nikki and Lily and Kathy and her team have been heavily involved in coming up with that branding and talking to staff and getting that as an answer. So thank you for that, and well done. I look forward to seeing that later on today. The communities of the West are sorely lacking in specialist brain injury services, including a purpose-built brain injury rehab unit. People that need those services need to go out to Caulfield or Talbot, which is miles away. Any thoughts on whether the new Footscray Hospital might look to address this? I think the sad answer is no, it won't address that. We will have some rehab services in there, but it won't be of the specialist nature of those services. The state is very restrictive in when it allows specialist units to be created. And at the moment, we're seeing quite a lot of shrinking in specialist services to have a statewide footprint. Victoria as a population centre isn't that big. And in terms of world's best practice, most population centres of our size have kind of one single unit for those kind of specialties. And that's across a whole range of different things. The cardiac hospital, or the heart hospital down at Monash, is causing some interesting discussions about how that will impact on the cardiothoracic model around town. At this stage, no, there are no plans for that sort of specialist brain injury rehab unit to be built in the West, or in fact anywhere else in the state for that matter. Sorry, that's not a more positive answer, but at the moment we wouldn't get much of a good hearing on that to move that one forward. I'm just checking another question box. When will we start to get some lifting of restrictions to get people back onto their home wards? There's a number of outliers and a whole range of wards which makes planning and discharges very difficult. Yes, so thanks for raising that. It's challenging, I know. At the moment, we've still got a lot of COVID patients and SCOVID patients. So we've got some of our home wards. I know the stroke and neuro ward, for instance, is now a COVID ward and not a stroke and neuro ward. We hope to get them back as soon as we can, but we'll have to scale that one back as appropriate. So I'm afraid at the moment, you're probably going to have to put up with the slightly disjointed nature of where patients are. We're trying to get the right patients together in the right wards to stop that outlying and challenging ward rounds, but that's incredibly difficult at the moment with all the other things that the teams and I are juggling. I'd like to wave a magic wand and get everyone back because it's much better for patient and staff care. But sadly, at the moment, we haven't quite got the ability to do that. And we're also working through changes that keep coming out of the department through Safer Care Victoria about new requirements for what is required to isolate people and how that's done. So it still may be disjointed for a little while yet while we sort of bed down some of those changes that keep coming out. And the jury's still out around residential aged care and how that is working, and what the requirements are on admission from an aged care facility that either has or hasn't got an outbreak, or, you know, those kind of things. So again, a lot of active stuff that government are doing for us and with us, and we continue to see kind of where we're going with that. So my apologies that it's slightly more challenging than it would otherwise be, but I think whilst we still have a fairly high COVID and suspected COVID load, we'll probably have to continue in the way that we are for a little while longer. That seems to be all of the questions. There's my one left. So if there's nothing further, thanks again for your attention. Oh, I lied. There's two questions from me to you. I asked this last week, but it got missed on the wider one. So please don't feel you've got to answer now. One was around how often these forums should be and do people still find them helpful? You can say, no, I'm a big boy, I'll take it on the chin. If you say no, I had a couple of emails after last week's live stream that it might be better going to fortnightly, but some people were still saying weekly, so happy to hear more views on that. And the other question I posed was around people not forgetting the learnings from wave 2 and jotting them down. We will set up an email to get them back so that I can kind of get them, and we'll use those as part of our sort of, you know, loop process to learn. So if you've got some learnings, we've heard a couple of days about home wards being disrupted and some challenges on that front, the annual leave side of things, please jot them down whilst you're thinking about them today or when you're hearing this streaming, and then let us know. So I would really like to get those learnings from the staff. You've been at the front line and dealt with it, and you face a lot more than I have. So I'd really like to capture what went well, what didn't go well, what some of your frustrations were, so we can get that. So Bit of a pitch from me, 2 things. One is the frequency of the forums, answers on an email or a postcard. The second one is around capture your learnings, good, bad, and indifferent, and then drop them in on an email that we'll put around in a bulletin at a later date. So thanks for those. Have a great day and appreciate you taking the time to listen. Stay safe, everyone. Thank you.